All righty. Well, welcome. Thank you for joining me today. I hope that you find this informational and helpful, understanding what HealthShare is and how it works, basically how it can bring peace of mind and security to your healthcare consumer decisions and to the things that you need to take care of on a routine, but also emergency type basis. So let's jump into it. Again, my name's Eric. I have been helping people understand HealthShare and join Zion HealthShare for the last, since 2019, basically. So a little while, and I've helped thousands of families come to understand how HealthShare works and utilize HealthShare. And I've seen many, many cases of HealthShare being a very helpful, supportive entity and service for those people and those families who have needed it when they had emergencies or other issues come up. And so I'll get to it and share this with you, but feel free to reach out to me. I am available on my website. If you go to whatishealthshare.com or whatishealthcare.com, both of those lead to the same page, but you can find more information there. You can schedule a call with me there. You can see pricing and other things there too. And so we may visit that site at the end of this presentation just to have, just to give you that information or a review. So to start off, so what is the problem with healthcare today, right? So as you know, many of you probably have experienced, and people have told me that their monthly costs for insurance have skyrocketed. They're paying a lot more than they paid last year, and a whole lot more than they paid 5 years ago or 10 years ago. And so why are these costs going up? What is going on? So this is the problem. So we need to look at. So deductibles are high, the network system is broken, claims, there's they play games with the claims, denials, delays. Of course, employers and employees are feeling the squeeze as well, financially. So it's not making a lot of sense, and it's costing businesses a lot of money. And we could go into what the problem is, but it's just designed that way. It's designed to incentivize bad behavior, I guess you could say. And so what I'm proposing as an alternative to that is HealthShare, right? So HealthShare is a nonprofit community. It shares in those major medical expenses directly without the insurance middleman. And so what do you get when you have that? You have lower costs, you have flexibility in your choices, and you have a community-driven solution that is there to help one another and lift one another's burdens. To really understand what HealthShare is, we have to understand what it's not. So HealthShare is not insurance, right? It's not an insurance product. It's not an insurance plan. Has nothing to do with insurance. It's also not ACA compliant by itself. So there are certain things that the government has said, hey, in order to be qualified as a minimum value plan or this ACA qualified plan, you have to meet certain things. Those are not going to be in this as well. So if you're looking for ACA or have an ACA requirement in your state, then we might have to look at something a little bit different. And I do have things that could help. There's things like MEC plans and other stuff that could help meet those requirements. And so we can talk, or you can visit my website again at whatishealthcare.com, and we can chat. So it's also not guaranteed or contracted, right? There's no contractual agreement with the HealthShare. HealthShare is a voluntary community organization. You volunteer your dollars there to help and go out to other people who are in need. And then those dollars come to you when you are in need. And so there's no contractual agreement. And that's probably the biggest selling point for insurance companies is to say, oh, health shares won't work because they're not guaranteed to pay. Well, that's actually literally true. And if we were guaranteed and contracted to pay, we would be insurance. And so it's one of those things of like, we don't want to be insurance, so we don't want to be guaranteed or contractual in our statements, right, in our organizational structure. And so, and also the contributions you make every month to the health share are not tax deductible because you are the member, you are earmarked to receive the benefit of that membership. So who can join? Ages 18 to 64. This is at the 65th year when you graduate, when you graduate, right? When you turn 65, we go to that big system called Medicare, and so we can't really help once you've hit 65 and on. So this is really good for 18 to 64. Kids can be added into your membership at any time. There's no medical underwriting required. individuals and families and entrepreneurs. This is a great solution for you if you are an entrepreneur and have a business and you're looking for a solution. I love working with door-to-door sales. Those type of individuals who are out there knocking the doors and typically taking on all the risk and all the responsibility to earn their living. This is a great solution for you guys if you hear this message. Employers, also, there are no participation requirements with the health share, so you don't get dinged, and your rates don't adjust or change if you don't get a lot of people interested in this particular product. And but it's a great product, and the costs, I think, when people see what it costs for an individual or for an employee to jump onto the health share product, then it's almost like a no-brainer. It's like, well, why wouldn't I? It's very affordable. And so, how does it work, right? So when you look at a health share to join the health share, you're going to have the opportunity to choose between different IUAs. And IUA stands for initial unshareable amount. So think of it like a per need or a per occurrence amount that you would pay out of pocket, right? So that's the amount you're saying I'm going to pay before the health share community steps in and pays, right? And so you submit your medical need online, and the community shares in the rest of those bills over that amount that you said you would pay, right? And so we have three options. We have a $2,500 option, we have a $1,250 option, and a $5,000 option. So you can choose between one of those three plans, those plan options there, and the IUA amounts, and you pay that once per medical event, right? Now, anything that's related to follow-ups is going to be included. It will pay for those. Anything that's related to, if you have to have surgery or have to have anything else that occurs after you've had those initial visits is going to be part of that medical need, right? And so the IUA really is better than a deductible because it's a one-time payment for a medical need, and until that medical need is closed, that's all you have to pay. You continue to pay your premium payments, or not premium, sorry, your contributions. You still make your contributions every month to the health share. As a member, you have to maintain your membership, right? Now, what's really nice is the health share says, hey, you only are responsible for the first three IUAs per household per 12-month period. And I put down a year, but it's the year starts with the first medical need, and then after 12 months, then that period closes if you don't have any others, right? But you would be responsible for three IUAs in that window of time. And so what happens if you have four, five, or six? And in some cases, there are those, people who do have four, five, and six medical needs. In those cases, then the health share would pay everything completely out of the health share, as long as it's over $500, right? So it has to be a true medical need. Can't just be, some random thing. It's got to be an actual medical need. And so you would submit that to the health share, and they would let you know, oh, there's no IUA required. And so then they would just continue to support you with that medical need. So what counts as a shareable medical need, right? So medical need requests include emergency care. So you have to go to the emergency room, urgent care, accidents, hospitalizations, surgeries, maternity. We also help with maternity, but that starts at 2,500. Even if you have a 1,250, IUA, you would pay the first 2,500. And then also any type of serious illnesses that might arise, right? And so that's basically what counts as a shareable medical aid. So pretty much everything. So what's not shareable? Well, okay, so these are the things that we wouldn't share in, and they're more along the lines of like small visits, routine care, doctor visits. Maybe you're the kind of person who likes to draw blood every quarter just because you're following your markers so closely. Things like that would be considered routine. Those would not be shareable with the community because it's not tied to an actual medical need itself, like some sort of expensive medical need. These are routine things that you would do. And then also dental vision is not going to be included in health sharing. Elective procedures are not included. Typically, what we do is we look at medically necessary procedures, and so that's what we will pay for and help our members with, is those medically necessary things. And then pre-membership conditions. We do have a phase-in period or schedule that we use for pre-membership conditions. So basically, if you have something that's pre-existing, this is how we treat it, right? So these are things where you've already dealt with, and you have, right? The first year is considered a waiting period where we have $0 in sharing for those medical conditions. Those pre-existing only, though. Just remember, pre-existing. Anything new, it's going to be shareable 100% after you pay your IUA. Again, going back to pre-existing, so pre-membership conditions, $0 the first year. Year two will pay out up to $25,000. Year three, up to $50,000. And year four, every year after that will be $125,000. And so even if you spent 125 in year four and then year five comes along, 125 will be available again. Year six, 125 will be available again. So it does phase in and open up that door for you to be able to have dollars to share in those pre-existing conditions or pre-membership conditions. And I'll tell you the reason why they do this. The reason that they do this is to prevent people from taking advantage of the group. We want to keep that group solid. We want to keep it growing. We want members to stay. We didn't want people jumping in their first year, taking advantage of the group, taking thousands of dollars and then leaving, right? We want them to stay. We want you to stay, be a part of our family. Now, there is this thing called direct primary care, and direct primary care handles all the routine type situations. So you can actually go find a doctor, a telehealth, a local doctor who has their own DPC practice, and they would take you as a patient, but you'd have to pay whatever their monthly rate is. And so when you have a DPC and you at HealthShare, you bring together both pieces of the puzzle that complete the healthcare system that you're trying to build for yourself, right? And so you may want to look into a DPC doctor. I know some really good ones here in Utah, but also if you look at Dr. Simone Gold, she created what's called Gold Care. And Gold Care is a platform where you can have access to doctors, and those doctors are considered direct primary care doctors, and they can take care of you. And then you would have the HealthShare on top of that. And then also other products that are coming down the road too. So, and then, the next three slides are going to be about some add-ons to the HealthShare, right? So the HealthShare does offer a preventive care add-on. And this really answers the question of like, well, what if I need an annual checkup or something like that? So this will actually pay up to $175 per member for an annual visit, right? Also, it includes, if you have young children, well child visits, and then also adult preventive screenings if you're in your 50s plus and you need like a colorectal cancer screenings or mammograms. This will pay for those after 6 months of membership. So you just need to maintain that membership for 6 months. And then those would be included in this preventive piece. And anything in this preventive piece does not require you pay an IUA. These are going to be services that are available to you, but you do still schedule through the HealthShare and our care navigation team. They're there to help support you. We also offer, as part of our care navigation, we have a virtual care piece as well. And so this is quick, modern telehealth, forward-facing, looking at, right through the phone. You get to talk to a doctor, prescriber. You can have on-demand visits. You can have prescription refills. They also have some mental health options. And so all of this is part of the virtual care, and you can add this into your HealthShare membership, right? And so this is an add-on piece. And we also offer RX support. So if you have medications or that you're currently on a recurring basis, then this is a good solution to have because these medications would be at a discounted price or practically, $0 or $5 basically per month for the medication itself. But it's something that you can look at if you're interested or need medications, right? Now, we do offer maternity care for members. There is a 6-month waiting period for maternity. And basically what that means is you have to be a member of the HealthShare for 6 months. And then after that, it would be pregnancy would be eligible for sharing, right, with the community. And so your IUA for a pregnancy will start at $2,500, even if you have the 1250. Or 5,000 if you're on that tier, right? So it just starts at 2,500. Now that would include any prenatal, any delivery, any postnatal, hospital, OBGYN, C-section, or home birth. So there's a lot of great services here for growing families and those who want to have more children. Now, membership overview. So real quick, everything that we've talked about so far has been about the catastrophic health share, and then we have these add-on services that are available that you can add into your HealthShare membership, right? So the HealthShare membership I'm talking about is the essential membership. That is just the basic membership by itself. And then let me move this down here so you guys can scan the QR code. So it's basically the HealthShare membership. And then you have the preventive care you can add back in, or virtual care you can add back in, or prescription if you want that as well. Now, if you know that you want these services and you're just like, I want all of those benefits, those add-ins, then you want to have the direct membership. And the direct membership is the one that offers you all of those services. Instead of as add-ons, it includes it in the membership. And so that membership then becomes complete that way. So this QR code will take you to my website. This will take you to information related to pricing. It will take you to the link that you need to sign up so you can access the essential membership as well. So be sure to look that up. Or again, you can go to my website at whatishealthcare.com or whatishealthshare.com. Both of those will get you to the right page. So and then again, why people choose HealthShare? Well, it's pretty simple. So lower monthly costs, right? No annual lifetime caps, right? We want to make sure that there's no caps on the lifetime needs, the medical needs. Fast processing, between 5 to 8 business days. You also have freedom to choose who you want to go to for your providers. Now, what I do. This is what I do when I go see a provider. I typically will call them in advance and I'll say, "Hey, do you guys have a cash pay price?" And they usually do, and it's usually lower than their insurance price, which is surprising, right? And so then I'll pay the cash pay price, and then I'll hang on to that receipt, and then I can submit it to the HealthShare if I think it's going to be part of a larger medical need. And it has to be related to that same need, though, of course. And then it's also community based. That's why people choose it. We're helping each other. I'm helping my family members who are members of the HealthShare. I feel like I'm helping friends and anybody else who I've brought to the HealthShare. I'm contributing to the HealthShare and it goes to them when they need it. Some simple FAQs. Is the HealthShare the same as insurance? Well, it does similar things, but it's not the same as insurance. It's not going to qualify for any of the legal ramifications on insurance, ACA. Like it's like the second question, is it ACA compliant? It's not ACA compliant. It's not gonna do that for you. How fast are needs processed? Between 5 to 8 business days. Do I still pay out of pocket? The answer would be you pay the IUA amount that you select. So if you choose a 1,250 IUA or 2,500 IUA or 5,000 IUA, then that's what you would pay. Does it replace insurance? In my case, yes. I've replaced my insurance. I don't have insurance other than property and casualty, that type of thing. But health insurance, this has replaced my health insurance 100%. And does this work outside the US? The answer to that is yes. It does work outside the US as long as you're maintaining your residency here in the United States. Maybe you're out traveling abroad for a little while and something happens. In those cases, you'll probably end up paying out of pocket. But then if you hang on to those receipts, let them know you're paying cash, then the HealthShare can reimburse you the amount back. But you want to make sure that the bills are translated into English and you have a really clear understanding of what all the items and things were used, the itemized bill, so to speak, right? So if you're ready to create real healthcare freedom, this is what I suggest. Visit whatishealthcare.com and you'll get a clear understanding of what we're building, the information that is there. There are other products and services available through whatishealthcare.com if you're looking for dental or vision or true insurance products or anything like that. Some of those are there, so you can take a look at that. But HealthShare, definitely you want to go here because the link that you find for the HealthShare is the one that you're going to want to click on, because otherwise you won't be able to access the essential membership. Essential membership is only available through my website at whatishealthcare.com. And that's it for the presentation as far as the PowerPoint. And so thank you for sitting with me and understanding that. Let's take a quick visit over to my website and see what we can do about that. There we go. Let me exit this real quick. Let me go to a new browser. All righty. So let's go to healthshare.com. And so whatishealthcare.com. This is my website. Of course, we've got some primary care options and the HealthShare options. And so you can see how it works. There's some presentations there available for you to view if you're interested. Zion HealthShare. This is the actual website for Zion. Details and pricing are available here. This is the essential membership. And again, this membership is really only available through the link that you click on for Zion. And then here's our pricing. So if you're looking for a family and you're in your 30s to 49, I pay $544 right now for my family of 6. And so that's what I'm paying. And then if you want, and that's with 1250 out of pocket, right? So at some point, I might have to pay 2500 out of pocket, and or choose to pay that. Then my rate would go to 406, or 579 if I'm a little older. But if you're an individual, say you're an individual, maybe you want the cheapest monthly, right? So say that's the 5,000 IUA because the prices go down. If you're 18 to 29, $84. If you've got some young employees that work for you and it's just them and they're between 18 to 29, it's $84 for an employer. That's incredibly low as far as price, right? And so you could pay that for your employees and just say, hey, look, we'll cover you. And then if 5,000, is the IUA amount, maybe even the company chips in on some of that if they need to. If you're getting a little older, 30 to 49 is 111, 50 to 64, 165. I do have a lot of retirees, couples where the husband is basically on Medicare and the spouse is not quite yet there, and they need something to bridge the gap right between the two. Then what they've done is they'll put the spouse on this plan, and they'll be here for a few years at $165, which makes perfect sense. And then below we have our additional services. This is what it costs to have the preventive added back in, or the Zion prescription sharing program, or the virtual care. And so you can take a look at those and add that back into the amounts above. And so that's how that will work. If you click here to register, let's go visit the website here for Zion. So Zion HealthShare right here, as you can see, the affordable alternative to health insurance. When you're ready to join, just click join now, and then it'll take you through this form, and you'll just go through that. First, you create your credentials, and then you'll go back in and log in with those credentials. You'll confirm with an email. They want to make sure that the email is working, right? So you'll confirm on the email address, and then it'll let you log in. Once you've logged in, then it will take you through the process of an application. So I've got like one right here. I think I can show you. This application process is fairly simple. It has 7 steps. Let's see if it could come up. Yeah, 1, 2, 4, 6, 7 steps, right? So you put in your member information, mail. Let's change that real quick. Let's pick go. All right. So then you put in your mailing address. You can have that set up in there, and then you have your household. So if you have people you want to add, so if I want to add a spouse or a child, you can just add those in real quick, add them in. And then after that, based on my age or the information I put about my membership and my household, it would show up with the numbers. So we have the 1250 IUA, the 2500 IUA, or the 5000 IUA. And then here is the monthly cost. So 320, 289 or 207, right, for each of those. And that's under the essential membership right here. Make sure you click essential. Direct membership is available through here as well. So say you wanted to have all of that, you just need to click direct membership. If you click the essential and you say, hey, I want to add something into my membership under essential, then you just need to select like the one that you want. So maybe I just want virtual care. It's $5 more. It's selected, and then maybe I'm doing select this one here, and now I can hit next and go to the next window, which basically is the agreements. And this is everything we've talked about, talking about pre-membership medical conditions. There are some exceptions to the pre-membership medical conditions: high blood pressure, high cholesterol, diabetes 1 and 2. They're not considered pre-membership medical conditions, as long as you haven't been hospitalized in the last 12 months and you are controlling it with medication and diet, right? And so that's good to know. But then you would go down here and you just sign away if you can with your mouse, right? And then you hit down here, you check these boxes and you hit next, right? And so then from there, it takes you to payment method, and you can choose a bank account or a credit card or any of those methods that work for you. And then there's a summary page. You also, going back to, let's see if it'll let me. You can go back. Let's see here. Let's go back. You can choose your start date. That was important to know. And so right here, that was the effective date that I changed here. So this is the effective date. Effective date means when do you want this to take place, right? When you want it to start. And so I had picked just a random number, but maybe I choose May 1st. Maybe May 1st is my effective date. So I can pick that today, and it will bill me today for May, all of May, and then at the end of May, just before June, it will bill me for June. And so depending on how far out you push it, it'll still charge you up front today, and then you'll have to, you'll go through that month, that first month that it's turned on, and then it'll charge you for the next month at the end of that first month. So and so that's how that will work. So yeah, it's very simple system. Definitely go and check out what is healthcare.com. I'll probably be refreshing this website soon, but right now this is where I've got a lot of information available, including dental insurance if you need dental insurance, or if you're a business and you're wondering what this would cost for a business, then you can contact me. Just book a call, and it will open up this page and just let you choose a time on my calendar, on my schedule. So anyway, there we go. There it is. So then you can choose a time that works for you. And so anyway, if you have any questions, feel free to reach out. Happy to help, happy to serve, and get you on the right track for healthcare sharing, HealthShare ministries, and the alternative to insurance, right? And this is a lot better of a solution than you'll find in the marketplace. And again, that's my opinion. So, and so I appreciate you. Thanks again, and hope to see you soon. Have a great day. Talk to you later. Bye-bye.